This non-invasive approach, using nerve conduction studies and ultrasound, is used to specifically and sensitively assess the axonal degeneration in carpal tunnel syndrome patients. This method can be used by clinicians to directly assess the pathological stage of the disease and can be easily applied for better treatment region planning. Demonstrating the procedure will be Phoebe Chau, an enrolled nurse, and Kwok-Pui Leung, a physician, both from my laboratory.
To measure the conduction in the median sensory nerve, first have the patient wash their hands with warm water. After drying, place the recording ring electrode at the proximal interphalangeal joint and the reference ring electrode over the distal interphalangeal joint. Place the other recording electrodes at the wrist between the tendons of the flexor carpal radialis and the palmaris longus, 12 centimeters proximal to the recording ring electrode, and, ideally, proximal to the distal wrist crease. After making sure that the ground electrode is between the stimulation and recording sites, apply supramaximal stimulus 10 times to the median nerve via the attached electrodes over the index finger. To measure the conduction in the ulnar sensory nerve, place the recording ring electrode halfway on the proximal phalanx of the 5th digit, and the reference ring electrode 4 centimeters distal to the recording ring electrode. Place the other recording electrodes near the tendon of the flexor carpi ulnaris, 12 centimeters.